yourself.
Oh, no.
Okay, you're live.
Hi guys, it's Danielle with Dr. Emer's office. We are coming live to show you our Fraxel treatment today. So our patient's been very active for a long time in the sun and has accumulated a little bit of early sun damage. So we're using Fraxel not only for the cosmetic benefit of reducing pores and lines and resurfacing the skin, but also to eradicate any little precancerous lesions called actinic keratoses. These are little spots that kind of feel flaky or dry on the skin, and they can develop into something worse. So by using Fraxel either once or twice a year, maybe quarterly, depending on your need, you can actually go in and sweep the skin of all these irregular cells and make sure that it is healthy, clean, smooth, and youthful. So this is our Fraxel device, and we're using today our more superficial Fraxel setting. So we're going to work more closely to the surface of the skin for the sun damage, pigmentation, and pores, as opposed to the deeper setting, which targets lines, wrinkles, scars, that kind of thing. So one of the things I want to really talk about today as we do our treatment is how you select using your laser, what treatment's going to be best for you, and how to prepare for it and care for it, because we all have very active lifestyles. I'm going to start on your forehead while I talk, okay? So we all have very busy schedules, and sometimes it's hard to schedule your treatments and accommodate downtime. So with Fraxel, it's very customizable. Depending on what your skin concern is, you can be treating the surface, treating deeper, and then you can also customize how much downtime you have. So with Fraxel, you're looking at some redness and mild swelling, anywhere from 3 to 7 days usually. So for our patient who wants to be active, wants to be working out, has an event this weekend, but also wants to have a great result, we can kind of compromise. We can do these stronger, more aggressive settings and slightly adjust the number of classes in some areas, which would actually tone down the amount of coverage that we have. So when it comes to lasers, the amount of coverage or surface area being treated is also a factor in how strong your laser treatment is, not just the depth of how deep the energy is penetrating and how strong. So in talking about how to get a good, strong treatment in, one that's going to give a good result, but also allow him to be ready for the weekend or for his daily activities, we talked about avoiding the sun, avoiding anything that's going to really increase his heart rate or blood circulation, because that is something that is going to contribute to swelling and redness. So slight modifications in your day-to-day activities, and then also implementing some really good skincare to protect the effect that we've had on the skin. So the way that this energy is working, this device rolls over the skin with these little rollers here, and all these little points are delivering energy to the surface of the skin, which is then shooting deep in little columns. And those columns of energy that have been applied to the skin are going to form these very small little scabs and flake away. That's how you get that skin resurfacing. You doing okay?
Yeah.
So the more passes that we do, the hotter and scratchier it's going to feel. We do topical numbing, but it can still be a little bit uncomfortable, so we're actually almost done here. So for our patient, he knows that there's going to be an incorporation of growth factors, healing serums, hydrators, some vitamins, hyaluronic acid, all of these products to really help him heal as quickly and ideally as possible. And he asked me if he can be swimming. And so with swimming, what I want is for him to be indoors, which he will be, avoiding the sun, but also have a nice protective layer on the skin, just so that you don't have any chemicals or pollutants or contaminants touching the skin if we can avoid it. So we're going to talk more in detail about that as soon as we're done. You're doing awesome. And as you're treating the area, it's just going to develop a little bit of a whitish tint to it, and then redness will start to settle in, and that's your clinical endpoint. Are there any questions about Fraxel?
No, they're just asking again what it is and if it's painful.
Is it painful?
The numbing helps a lot.
Numbing helps a lot. We also just, did some other treatments. like might be painful. Fraxel develops, so it is a little bit hot, scratchy, and uncomfortable, but the pain that you would experience develops more so towards the end. The more passes that you do, like I was saying, the more coverage. So as you build up, it's like you're getting up to 60, 70, 80% of coverage of the skin, and that's a more thorough treatment. And a more thorough treatment will give you a little bit more downtime.
Who is a candidate for this treatment?
So that's a great question. So Fraxel can be used on different skin types. Very carefully in darker skin types, the ideal candidate for any Fraxel treatment would really be someone who has lighter skin, Fitzpatrick types 1 through 3, light skin, light eyes. They're a great Fraxel candidate because they have less risk of pigmentation, and they are also the skin types that tend to develop more skin cancer. So they're great candidates, but if you have an area of concern like acne scarring or some sort of scarring, even just lines and wrinkles, you can be a candidate for Fraxel treatment with some good skin preparation. And so we often pre-treat the skin with a brightening and pigment suppression protocol. Some patients begin using pigment suppressive products for a few weeks prior to treatment. Others actually do a good strong chemical peel like Enlighten or Cosmelon. And what those peels do is they suppress melanin in the skin. So as long as you keep those melanin pigment cells suppressed, you have a much lower risk of developing hyperpigmentation in response to the heat of the laser. So depending on your skin type, the concern, there's a lot of different good candidates. So again, we're using the 1927 wavelength, and what that means is that we're putting this energy a little bit more superficial in the skin. We're resurfacing, lifting up pigmentation, sun damage, smoothing of fine lines, shrinking pores. And what this does is it really keeps the skin smooth, youthful, and healthy. And any other questions?
Not at the moment.
Awesome. Well, that's Fraxel for you guys. So if you have any questions, please let me know. I'm always happy to reach out and answer them for you. Our patient's doing great, so I'm going to go ahead and finish up. I will see you guys soon. Thanks for watching, everyone.